Clostridioides difficile infection, a call for breaking the cycle.
So I'm Gail Atara. I'm the President and Chief Executive Officer of the Gastrointestinal Society, and we've been around helping patients since 1976. Now, living with C. difficile infection can include things like fatigue, mental anxiety, lack of sleep. It can include the explosive diarrhea, smelly diarrhea, a lot of just soreness. I just wanted to mention a little bit about antibiotics. Antibiotics are a good thing. They help in a lot of cases, and antibiotics are needed to treat C. difficile infection. But the challenge is that antibiotics can also trigger a C. difficile infection. So you get an antibiotic from your doctor, from your dentist, and the next thing you know, you end up with a C. difficile infection because it upsets your whole gut microbiome. So the thing about C. difficile infection is there is an unmet clinical need. We have to address the issue of recurrent C. diff because once you have a C. difficile infection, you become more vulnerable to recurrent C. diff, and it can go on and on and on. Not only does it have a burden for the patient to go through this and live this, it has a huge burden on the healthcare system with all the resources that are needed to manage someone who has C. difficile infection. So what we really need to do to manage the whole C. difficile infection, recurrent C. difficile infection, is to manage the whole cycle of recurrence that happens, and that is by restoring the gut microbiome. And that's done currently. Although not widely available, it's done currently through FMT. And I think that if we can find a better way to do that, then we will have a better way to manage it and lessen the burden to the healthcare system by actually having a treatment that is easily accessible and can be administered by a nurse in a long-term care home or in a doctor's office that can be administered that way. Then we're breaking the cycle of recurrent C. diff and decreasing the amazing, incredibly high burden of cost to the healthcare system. So I strongly encourage all healthcare practitioners to make sure that they look at the options that are available to manage and prevent a recurrence of C. difficile infection. This will help our healthcare system immensely. What Canadians need is approved medications that will help restore the gut biome after a C. difficile infection so that they don't face that trauma of having to have a recurrent C. difficile infection. And I'm hopeful that we can have products for patients so that they can let go and leave C. difficile infection in the rearview mirror.
To learn more about C. difficile, visit badgut.org.